Hi, my name is Dr. Sudha. I'm one of the consultant neonatologist and the pediatrician at Lotus Hospitals. Today I would be discussing about essential newborn care, which is the care that we provide to the newborn soon after delivery till the time of discharge. So pregnant mothers have a lot of worries and anxieties like what will happen to the baby after delivery. So I'm here to address some of those issues. So as soon as your baby is born, baby would be taken to the resuscitator, and the pediatrician or the neonatologist who is present will examine the baby and make sure that baby is in good condition. They check the oxygen saturations to see that baby is maintaining oxygen levels well, and they also check the baby's weight. We give an injection to the baby after the baby is born, which is injection vitamin K. This injection helps in prevention of bleeding in the newborn period. Now I'll talk about what are the anticipated problems that babies will have after delivery. The two common problems that babies have after delivery are hypoglycemia, which means it's low sugars, and hypothermia, which is low temperature. So there are things that we can do to prevent these two complications occurring in the babies after birth. So first I would like to talk about hypothermia, which is low temperature, which is defined as the temperature less than 36.5 degrees centigrade. To avoid that, babies soon after delivery should have skin to skin contact with the mother. Skin to skin contact means that baby is held between the breast of the mother directly so that the temperature is maintained. This we can give up to 1 hour after delivery. After that, baby should be wrapped up properly in soft cotton blanket along with hat over the head, and also baby should have socks and mittens to prevent temperature dropping down. The next anticipated problem that can happen in babies is hypoglycemia, which is defined as low blood sugars in the babies. Hypoglycemia is never good for babies as it can cause problems with affecting the brain and can also lead to other complications. So to prevent hypoglycemia, we encourage mothers to give breastfeeding soon after delivery. So breast milk is the best milk for the babies to be given, because breast milk is easily digested and easily absorbed. It is readily available at room temperature. It also provides immunity against infection, and studies have shown that it also helps in brain growth and development. So every mother should breastfeed the baby regularly every second hourly, and on average a baby should take about 10 to 12 breastfeeds in 24 hours. Baby should be also breastfed in the first 6 weeks every second hourly at night time also. Now there is a question about whether they should give any other complementary feeds. Ideally, I would not suggest babies to have any complementary feeds such as honey or formula feeds or cow's milk or buffalo's milk or sugar water up to 6 months of life. Breast milk is the only feed that is necessary for the babies in the first 6 months of life. Next risk factor that the babies can have is infection. Babies are protected in utero. Once the babies are born, they are exposed to various exposures which can have increased chances of infection. To prevent infection, we should always encourage the family members as well as the healthcare workers that they should do hand hygiene properly before handling the baby, and also deliveries of the baby should be done in a safe practice. In this way we can avoid infections. I'll also talk about vaccinations. Babies who are born, they get vaccinations in the first 24 hours of life, which are 3 vaccines: BCG, which helps in prevention of tuberculosis; hepatitis B, which helps in prevention of hepatitis B infection; and oral polio vaccination. All babies who are delivered should have vaccinations prior to discharge, and they should also be counseled or educated about the subsequent vaccinations before discharge. In Lotus Hospital, we also do newborn screening program, which includes one for hearing test and other is for blood prick test. So this blood prick test is done to detect some of the congenital anomalies that can happen in babies, such as congenital hypothyroidism, G6PD deficiency. Congenital hypothyroidism is a common metabolic problem which babies, if not detected early, can cause severe intellectual damage after 6 months of life. So this is a newborn screening blood test, is a heel prick test which is done at 72 hours of life, and if that test comes positive, they need to be treated appropriately, and it helps in detection of these problems. The other thing that I have discussed earlier is about hearing newborn screening, which should be done because up to 6 months we are not sure whether the baby is hearing properly, and if it's not detected early, it can cause speech and hearing impairment, and that will have long-term consequences. So we at Lotus Hospital, we do a hearing screening program called OAE, which is a simple test which does not cause any pain to the baby, and it will detect any hearing defects.
Lotus Hospitals is one of the leading brands for all your health needs. You can visit our expert doctors at any of the centers, Lakdi, Kukatpally, Nagar and Vizag. For booking an appointment, you can use our app or visit www.lotushospitals.in or call on 040 4040 4444.